We are covering Medicare Part B medical insurance for your health insurance exam. The exam will test your knowledge of what Part B covers, what it excludes, and its associated costs. Part B covers outpatient services and supplies that are medically necessary to treat a health condition. Think of things like doctor visits, ambulance services, outpatient surgery, and preventive care like flu shots. A heavily tested area is durable medical equipment, or DME. If you see a question mentioning a wheelchair, hospital bed for home use, or oxygen equipment, that falls squarely under Part B. After the annual deductible is met, Part B generally pays 80% of the Medicare-approved amount for covered services, and the beneficiary is responsible for the remaining 20% coinsurance. For 2026, the standard monthly premium is $202.90. The annual deductible for 2026 is $283. A common exam trap is to confuse Part A and Part B coverage. A simple way to remember is Part A is for admission to the hospital, while Part B is for, by the way, I need to see my doctor. This mental shortcut helps you distinguish between inpatient hospital care under Part A and outpatient physician services under Part B. The exam loves to test exclusions. You must know that Part B does not cover most routine dental care, eye exams for glasses, hearing aids, or long-term custodial care. Questions will present scenarios where a client needs dentures or a routine eye exam, trying to trick you into thinking it's a covered medical expense. It is not. Another area the exam may touch on involves higher income beneficiaries. Be aware of the income-related monthly adjustment amount, known as IRMAA. This is a surcharge added to the standard Part B premium for individuals with income above a certain threshold. For 2026, this surcharge applies to individuals earning over $109,000. You won't need to memorize the specific surcharge amounts, but you must know that higher earners pay more for Part B. So, to recap for the exam, Part B is for outpatient medical services and DME. Remember the 2026 standard premium of $202.90 and the $283 annual deductible. Be ready for questions on the major exclusions like dental, vision, and long-term care. And understand that after the deductible, there is an 80-20 coinsurance. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.